Welcome back to Wave Listens Live. Joining me now is Dr. Regan Ackerman from Freedom Mini Dental Implants. Dr. Ackerman, always a pleasure to have you on Listens Live.
Yes, always. Thank you.
You always come with preparation that involves show and tell, and as a visual learner, it's always awesome to see all the stuff that you do. So we want to talk about that. So these less invasive, small diameter implants are so much easier, it feels like, to do, and so much easier to recover from, so much less of a hassle than some of those bigger ones, and you can really see that with the stuff you've got in front of us today. So walk me through some of the stuff that you're doing to help people get their smile back, and then we'll get into what that actually looks like. Yeah, exactly.
Yeah. So we say mini dental implant just because it's a smaller diameter implant. So just like he said, it's a lot less invasive. The biggest thing is I don't have to have as much bone to place an implant. Actually just had a patient come in the other day, had a tooth taken out, had gone through bone grafting, healed, went back to the oral surgeon to have it checked, and they were like, sorry, we can't do an implant there. There's not enough bone. She came to my office. We did a free consultation. It's no charge. Took a 3D x-ray, and I was able to tell her, yes, I can help you replace that missing tooth. I can use a smaller diameter implant and replace that missing tooth. And of course, she was ecstatic about that. And I can use these mini dental implants for people struggling with dentures. You know, either you're not wearing your denture at all because you can't keep it in, or you're using, you know, tons of denture glue to keep them in. A lot of times I can use your same denture if you like the way it looks. I place the mini implants. The day I put the implants in, you can leave with your denture snapped on to those implants and no more glue, and you can eat better. And then we'll do the show and tell, but we also do a permanent teeth version where you don't have to take anything in and out anymore. You have nothing on the roof of your mouth. So there's so many ways I can use these small diameter implants.
So, I mean, you can see visually the holes that go into the bone here. I mean, you talk about, yes, it's smaller, but it is significantly smaller.
I think this model just speaks volumes. So when I place an implant, this big hole that's easy to see, I do not have to make that hole. So I don't have to have as much bone to place an implant. So I'm going to cover that up because that's not what I do. When I place an implant, I will, numb you just with local anesthetic. I don't have to put you to sleep. I'm not making any incisions or stitches. I essentially make this little hole right here, and then my implant is just a smaller diameter one-piece implant that goes into the jawbone. But this just shows that I do not have to have as much bone to place an implant. So many people that were told they weren't a candidate for implants, or they needed major bone grafting, or maybe you've had your teeth out for a while and you don't know if you're a candidate. Many times you can be a candidate for the mini implant.
And the things that end up going in the mouth, in those implants you've got in front of us here, all the way from the full teeth, you talked about even transforming the denture you already have, all the way down to the individual teeth here as well.
Yeah, and this was kind of the scenario, the patient that had come in and was told wasn't a candidate, missing a single tooth, and she's going to come back in a few weeks, and I will numb her up local anesthetic. The day I put the implant in, she'll leave with a temporary tooth that day, and then she doesn't have to wait another 3 to 6 months, to use this implant. She'll come back about 4 weeks later, and we'll have her final pretty permanent tooth, and we will submit that on to this implant, and then she will be able to smile again with confidence, eat again with that area. So it's a tremendous option for people, and it doesn't have to be a single tooth. Some people are missing, multiple teeth or the back molars. So I'll, just place more implants in a row there, and then we make what we call bridge, and then this gets cemented on permanently as well. So you can chew again. If you have a partial, you can get rid of your partial, whatever it is that you want to replace. There's many different ways that I can use.
And we've got some examples for the next two that you're going to show.
Yes.
So let's take a look at some of this pictures, some before and afters that show just how much you can help change a smile.
Yes. So she came to me, her teeth were breaking down on her. She knew she needed to have them all removed. So we were able to do what we call the permanent teeth, which we'll show the models of. But so that new bridge that she has in the after picture is cemented on. She doesn't take anything in and out. She has nothing on the roof of her mouth. She can taste all her food, so it's not a denture, nothing, that she has to worry about using denture glue all day. And I think this was just, her confidence as far as her smile went, through the roof.
Show us what that looks like on the model here.
Certainly. So, we talked about placing the implants, no incisions, no stitches. You don't have to be sedated. You can drive yourself to the office. I'm just going to place more implants when we do this, the permanent teeth. And then we have a bridge of teeth here. This gets cemented on permanently onto those implants. Then you have nothing on the roof of your mouth. You taste all your food. You brush it just like regular teeth. We give you a water pick to keep it clean, but this is like having your natural teeth back. You can eat steak again and salads and all those foods you missed. You can eat with these.
And real quick, we got one more and we got about a minute left. Let's show this next picture and talk about what he's got as well.
So he had to have all his teeth removed, struggled with dentures, needed a better option. So we did snap-in dentures for him. But this got his confidence back. He can eat again, smile again. So those dentures he wears 24/7. He just snaps them out once a day, rinse and cleans them, and snap them back in, but no denture glue.
A lot easier, and like you mentioned, you've got that example here.
Yes.
We've got some. You could show that.
Yeah.
That one, the difference from the permanent teeth is obviously you snap in, snap out, and the roof is covered. But there's also lessen implants that are in there as well.
Yes, just lessen implants. But the day I put these implants in, I put the attachments inside the denture. So that day you leave with the denture snapped on to the implants. So no more denture glue, no more floppy denture, and you just take it out once a day, rinse and clean it, and snap it back in. It's a fantastic option for people struggling with their dentures.
Freedom Mini Dental Implants. You can visit them at freedomimplants.com or call the number on your screen, 502-937-4930. Dr. Ackerman, pleasure as always.
Thank you.